Good evening. 1 year ago today, South Dakota health officials announced COVID-19 had arrived in the state.
Since then, more than 1,900 South Dakotans have died from the virus. A majority of the victims were 70 years old or older. 869 were long-term care residents. In tonight's Health Beat, KELOLAND's Sophie Heineman talks with the Good Samaritan Society about what the last year has been like and how a new hope is building.
Linda Studer works in administration at Good Sam Lutheran Manor. Her position includes daily interaction with residents, meaning she saw firsthand just how devastating it was when COVID hit.
When the pandemic started, we believed that, this was going to be 3 months. And then we thought it was going to be 4 months. And then it was 6 months. And then it was 9 months.
And now it's been a year full of challenges, loss, and perseverance.
We talked about kind of early on, shutting down was kind of the easy part, but it was the hardest part.
Virtual and window visits became the norm for residents everywhere. Nathan Shima says GSS staff began working around the clock to protect each other and residents.
Every resident death has been an absolute tragedy, and we mourn every single one of them. So, our focus right now continues to be how do we open back up? How do we open back up safely?
He says visitations rely on county positivity rates, which climbed in parts of the state last fall. As we mark a year, Rochelle Rindell says vaccine distribution and COVID therapies are saving lives and bringing hope for the future.
So since December, when we really gave our first BAM or antibody infusion, we've given over 300 doses to our residents in our locations. And that would estimate out to preventing around 17 hospitalizations and 2 deaths among that population.
On the day of our interview, Shima says GSS was reporting a 0% positivity rate among staff and residents throughout South Dakota, with over 80% of residents vaccinated.
It's almost hard to describe because we've seen some really tough times. And, I think the hope that it gives me is that, there is that normalcy that looms out there.
Our nurses are so proud to be able to offer the infusion and now the vaccine to the residents because they have seen the deaths and the loss in the facilities. And this is really the way out. This is the light at the end of the tunnel.
I'm just really proud of our Good Samaritan staff and all that they have done over the course of these last months.
With Health Beat, I'm Sophie Heineman.